Good morning, everyone. I think we're waiting for a couple more people to come in the room. Is that right, Isabel?
Yep, that's right.
Just let us know, Isabel, when everybody that we're expecting is here.
You guys remember, I think Judy was the only person who might not be able to make it. Am I remembering that
Oh, it looks
correctly?
like she's here.
Oh, well, hot diggity.
So is that everybody?
Cheryl was the only person.
Oh, Cheryl. Okay. Great.
So, yeah, I think that's everyone I'm expecting.
Great. Welcome, everybody. Good morning and happy Halloween. So thanks for making time for this kind of extra meeting for just kind of going over the communications and our community engagement and communications committee kind of updates and discussion. And I think, do we need to do a roll call? Did we decide that, Isabel?
Let's go ahead and do one. Helen Belanca,
Here.
Judy Richardson,
Here.
Chun-Wei Chi,
Here.
Amy Fellows,
Here.
Michelle Glass,
Here.
Bruce Goldberg is on leave, Mary Lou Henrich. I see that you are here. Are you able to unmute?
Here.
Thank you. Cheryl Ramirez is not able to join today, and Mike Leahy.
Here.
Thank you. That's everyone.
Great. So I think we'll just dig right in, so we don't have to necessarily take up too much of the morning. So we wanted to remind everybody about the communication tools that are available. And that includes the one pagers that you all gave input on. We just got them back from DCBS. So I think following this meeting, Michelle and I will work to make sure that Isabel has kind of a package of all the most current communication tools that can be sent out to you all so that you have those handy. So we did, like I said, just get back the one pagers from DCBS that reflect the input you gave at the last board meeting and that you sent in, I believe last week. And then there is a updated presentation template so that anytime if you need that, you can always request the latest version from staff. They are updating that as our work changes. And kind of the goals of the communication tools are really to support board spokespeople in communicating clearly and consistently in all settings, to support transparency, inclusion, and engagement, to provide clear, concise communication that builds trust, and to use plain language that everyone can understand. And just some context. So post-pandemic and post HR1, the landscape has changed dramatically since 2019. The board is dealing with new realities not anticipated by the Universal Healthcare Task Force when they did their work. We had a multi-year pandemic, global pandemic that upended the health system. Hundreds of thousands of Oregonians are facing coverage loss after HR1. other federal funding for health is being held back and the future of Medicaid waivers is unclear, the board's goal is to present workable models that adjust to these new realities while meeting the vision for affordable and accessible health care for all Oregonians. So we want our tools to reflect that. And then a reminder of what the current board policy and procedure is that we have. And then after this, Michelle's going to kind of go into a proposal that we have. So you all have seen this before, except for maybe might be new to Mike. But so our current policy regarding interaction with media, lobbyists, and interest groups is, unless expressly authorized by the board, no member of the board has any authority to speak on behalf of the board. The board operates as a single entity when communicating with external parties. If any member of the board receives a media request relating to the board business, or the member's work and participation as a member of the board, the member should promptly notify the executive director of the request by email. If any member of the board receives a request to discuss the board's work from interest or community groups, the members should make a request to the chairperson and executive director with the date, topic, and expected audience. Detailed minutes of these engagements will be expected, and the executive director will keep a record of them. The board will also develop a community engagement plan for active outreach to interest groups and communities as part of our overall work plan. So that was what we have currently as our policy. And then Michelle, I'm going to hand it over to you.
Thanks, Amy. Good morning, everyone. Michelle Glass, co-chair with Amy of the Community Engagement and Communications Committee of the board. Really appreciate your time this morning. So as you have seen, because our board agendas are so packed right now, and I know that all of us are holding a lot in our heads as important decisions are moving forward and straw proposals are coming to the board from other committees, we wanted to carve out some time to check in with you all on this next phase of work. So as you can see, we at CECC are really thinking of this next year, essentially, of our work as a board as a new phase when it comes to communicating with the media and with interested parties outside of the board itself. And so what we wanted to do is make sure that the board has all the tools and resources that we've been working with our communications consultant to develop. Everything we've covered is posted in previous meeting agendas and is on the website. And we, like Amy said, we can get you the updated version of those one-pagers that reflects your feedback at the last meeting. Thank you for that. But we wanted to make sure everyone had the resources and understood that they were here to support all of us in communicating with one voice very consistently. And we also thought that this next few months, at least until summer of 2026, is a very important phase of our work because we will be finalizing proposal details for what the plan looks like in terms of eligibility, benefits, finance and revenue plan, and we'll be taking those proposals with our community engagement consultant to get some feedback from the list of groups that we were mandated by the legislature to engage with. And then we'll be bringing that feedback back and incorporating it into a plan. So that phase of work is where we expect that interest in the work that the board has been doing will potentially have an uptick. So we wanted to make sure we were all on the same page about how we handle those requests and that we were all carrying the same message. So as you saw on the previous page, the current policy just asks that or requires that all board members notify the executive director of any request to speak to the media or to an external group. So that is already in place. And we have some resources, to provide you as you respond to those requests. What we are proposing for this next phase of the work is some potential changes. And this proposal we will not be voting on today. We just wanted to make sure to have time to talk through it with you all. And the vote will happen in this proposal will be in the posted agenda and materials for the next board meeting. So for this next phase, we've already seen an uptick. So in 2023 and 2024, We had, three media hits that covered the work of the board. But in 2025, that's gone up to 10, and we expect that it will go up in 2026 as we start finalizing some proposed plan details. So we want to make sure that we are doing a couple of things. One, protecting the volunteer capacity of board members. We are very aware that most of us are carrying, full-time day jobs, family responsibilities, other roles in our life, and that this plan development phase is very intensive and requires a lot of capacity and focus. So we want to make sure board members are supported in being able to get this plan done, which is the most important deliverable that we have for the legislature and for any future engagement. We want clarity on what the plan entails so that we can do successful engagement and let people know what we're thinking. We also want to make sure that as interest increases on our work, that there's no confusion being created and that there is plain language and the most up-to-date information shared at every engagement. And because most of us are in one committee and can't sit in all the committee meetings, and things are moving so quickly and there's so many proposals being considered, it is very difficult to track all of the changes across all the work groups and proposals at any given time as a volunteer board member. So that's a little bit of the background thinking that goes into and informs this proposal. So there's 3 parts to the proposal. I'm going to walk it through right now. And like I said, we're not going to be voting on it today. We just wanted to make time to talk it through with you all. So the first component is our formal written communications. When we had our first, when we were forming as a board and our procedures and policies were being developed, there was a lot about what the work was going to look like that we didn't know yet. And so I think really making it clear what the process is for formal written communications that are intended for an audience outside of the board. This, for example, is things like the report to the legislature and things of that nature. So all formal written materials, including documents, statements, reports, presentations, anything that your committee or the board is developing that's intended for an external audience, needs to go through the communications committee chairs and the communications consultant, just again to make sure that we're using the same terminology, the plain language we've agreed on, and that we have the most review for the all the context being included. So if a report's coming from a specific committee, there may be elements of work from other committees we want to make sure is also included so that the person reading that report has the full picture. So that's the first component of the new proposed policy for this next phase of work, is just formalizing the support that CECC has for any written external facing communications. The second component of this proposed policy is just to support you all as you have informal conversations in this, again, this kind of rapid-paced phase of work. So as you're talking to colleagues, as you're talking to friends and neighbors and family who might be asking about how things are going on the board, how the plan is coming along, we just want to encourage folks to be really thoughtful about how we're having those conversations. And that includes things like being really clear when we're talking about something that's a proposal under discussion, but it is not a decision the board has made yet. We are hearing informally some confusion already about the task force plan versus some of the things the board is considering now, because as Amy pointed out, a lot has changed since 2019. And the task force plan proposal was also done without the work of the consultants, the excellent consultant support that the board has now, right? So we're doing we have access to a lot more information, and a lot of the context in which we're doing this work has changed. So there's already some confusion about what the board's considering versus what the task force proposed. And then to add to that confusion, there are proposals that have not been decided on yet by the board. So we just encourage folks to be very, very clear with folks so that we're not creating confusion. We also, in this policy, urge board members to not speculate or guess. I know that I've had this when I've given presentations to external groups or talked to folks informally. people will ask questions. Is the board going to, do X? Is it going to be administered in this way? And if it's not a decision that the board has made yet, I just say that decision has not been made yet. I don't share my personal guess or opinion. And that really is a best practice in this phase of work, to avoid confusion and to maintain trust, right? And so, we really ask that all board members do that even in informal communication. If you're asked for more information, then you are able to provide, either due to time constraints or the level of detail folks are interested in. We urge you to refer people to the official materials and or to staff. Again, we've developed the one-pagers. You're welcome to email those to people or share them if you're having an in-person conversation. The website is going to be updated before the end of the year with the support of our communications consultant. So we do hope that that will be a more resource-rich place that people can go and find more plain language materials. So we will be updating that. And then, of course, folks can, attend our meetings and submit public comment. If you're unsure, again, how to answer a question, please direct the inquiry to the executive director. We're very lucky in Mimi, and Mimi is, really working across all the committees and has all the most up-to-date information, and of course has the excellent support of our incredible staff team. So that really is the best resource if people are wanting detailed answers to questions. The third and final component of this proposed update to our policy for this phase of work is really making it clear that Mimi, as the executive director of the board, who has that view of the most up-to-date status of the work across all the work groups and all of the consultants, is that Mimi become our primary board spokesperson. That, again, supports all of our goals, right? Protecting your volunteer capacity to really focus on making this plan thoughtfully and analyzing all of the documents and information that's coming at us. And then also making sure that people who are looking for information are getting the most up-to-date information with all of the context and in plain language. And always everyone that makes the inquiry is getting the same information, right? We're not playing any telephone. And so what that means to having a primary board spokesperson is with media inquiries, all media inquiries, no matter who they're received by, those would all go to Mimi. So I don't speak to the media. No board member speaks to the media on our own. Those are probably the most sensitive requests because they're going to reach the largest audience, and we want to make sure that everyone is getting that most up-to-date information in plain language in a very consistent, consistent information. So this would be a change if, when this comes to a vote at the next board meeting. This makes it very clear that not only do we let the executive director know if we get a media inquiry, but none of us are the spokesperson for media. So we don't go to the media, and if we get an inquiry, we pass that along to Mimi. The second component is for speaking invitations and presentation requests. This is similar to our current policy. It just says that if a board member receives a request, they can pass it along to our primary board spokesperson. So again, this is to protect all of our capacity because our number one job right now is to make the best possible plan. And there's a lot of work there. So if we, in our limited volunteer capacity, are focused there, we may not have time for all of the requests to speak at the groups that come, to us asking for updates. Those can now be passed along to Mimi. Thank you, Mimi, for graciously accepting this role as the primary board spokesperson. Now, that's not to say you cannot take on an external speaking request if you really feel strongly that you have the time, capacity, and are the best person to do so. If you choose to, you do still need to notify Mimi so that it can be tracked and so that you can get those up-to-date materials. So again, that you're using the most up-to-date language in plain language, and that that group that you're speaking with is getting the same information that they would get from the primary spokesperson. Again, this is to support all of us in this phase of work. Once we have a plan and we've taken it for those strategic engagement focus groups that we've been mandated by the legislature to complete next year, then we may be in a different phase again, and we may revisit these policies. But for now, this is what the Community Engagement and Communications Committee is bringing as a proposal to the board. And along with all of the resources that we've developed as we've completed our communications work stream, we hope that that will be a support of the board's work as more people tune in to follow us in this next phase of more active work as a board. So again, I think we've laid this out. We've talked a lot about how important it is to engage with the public. I would say, in addition to the importance of engaging, it's important to protect our capacity to make sure we have something to engage about. To me, that's the most important thing. If we don't get be able to focus now and make this plan a reality, then there's not going to be a lot to share with the public. So I'm really excited to get this plan mapped out, and so that we can go out and share it widely. A communications adage that I was taught in my 20s when I was being mentored in strategic communications was communicate when you have something to communicate about. So I would say in this phase, certainly we can let people know the one-pagers are a great resource for this, that the board is meeting, what our charge is, and that we are, where we're at in the process. But it's really once we have a draft plan that I think we'll have the most interest and the most to share and hear from community members. They really want to know what this might look like. And I'm looking forward to being in a place where we can share that with folks. It's really important that we have that consistency through this phase where things are changing quickly. And I know that we are stressing that, but I think confusion and the erosion of trust that confusion can create is something that could really undermine the great work that we're all doing. And so that is a concern that we really want to make clear today. Go ahead, next slide, please. So we have a couple of guidelines. I know that you all probably know this, but I do just want to...
Sorry, excuse me, Michelle, we're not seeing any slides.
Oh, you're not?
I am.
Oh, you are? And
Yeah.
it's just me? Oh, it might just be me. I
I'm so
apologize.
sorry. Yeah,
That's
I hope...
me.
They're really pretty. I'm sorry. You need to.
Oh, so sorry.
Oh,
That's just me.
go to the top, and sometimes you
I
have to
got it.
click. You got it. Okay.
Sorry.
Is everyone
No.
else seeing the slides? Okay. Sorry about that. I'm so glad you said something, Helen. Thank you.
Mary Lou, were you trying to say something? We couldn't hear you. You're on mute. That looked like you were trying to say something. You're still on mute.
Okay.
There you go.
I had not seen any slides either until just now, this one.
Okay.
We're there now, Mary Lou.
I didn't know there were any, so, okay, thank you. Okay.
So glad you said something, Helen.
Whoops.
So again, just a couple reminders for all of us. I know this is not new information to all of you, but just because we're in the weeds, in the details right now, especially those of you doing the heavy lifting on finance and revenue and plan design, we want to make sure we're using clear everyday language whenever we communicate about the board's work, and I know how challenging that is. We want to ground anything we're sharing about the plan in people's real lived experience, in people's real lives, right? This is about people, not about, plan details or crunching the numbers, even though that's an important part of the work that we have to do. We don't want to speculate on details not decided. We want to lead again with the plain language, what this means for people's experience with health and healthcare, not with complex policy details, even though that is something we're all immersed in. And we don't want to focus on just the problems without also offering hope. The reason that we're all doing this in the end is because we believe a better system is possible. And that's important because of what it means for people's lives and health. And again, just, we don't want to argue using data alone. Data is an important tool for us, but it's, again, about people's experiences and what it means for people who live in Oregon at the end of the day. So just a couple reminders as we are immersed in our spreadsheets. I'll pass it back to Amy.
Yeah, so we just wanted to kind of give a a update on what kind of is next for our community engagement and communications work. So finalizing the one pagers, updating the web content as we had talked about, finalizing the kind of PowerPoint slides, and finalizing in that the latest version, and then staff will continue to update and keep them current as things evolve with our work. But you can always ask them for the most current version. The draft legislative report, having it reviewed by communications consultant. And just a reminder on that, I believe we all have some feedback to get back to staff on that due end of business today. Community engagement consultant, planning begins. We just had our first meeting with Diana Bianco, or again, picking back up the work yesterday. So very exciting to get that work rolling. And then Q1 of 2026 is when we anticipate doing some of those targeted meetings with the legislatively mandated groups. And just a reminder that these are the groups. So we will begin, probably asking you all if you have thoughts of particular people or institutions that are in these categories that you think it would be important to invite to a focus group and be a part of that work. Please send those names to Michelle and I to share with Diana. And I think that is it for today. Don't want to take up too much of your time on this Halloween, but and I think we want to leave time for questions, discussion. And I see Mimi with her hand raised.
Thank you. Thank you so much for doing this. I'm really appreciative. I did want to get some clarification around one thing, and this is like the very slide number 1 of the proposal portion number 1, and it has to do with having materials being reviewed. There we go. Okay, so I just want to be clear that in terms of when we're talking about things being developed for an external audience, of course, all of our committees, there is an external audience. And so I want to clarify that my thought is that you're talking about this, that these all need to go before or to communications committee chairs or the consultant. Not all of our presentations that go before the committee or go before the board, but just exclusive of those, right? So I just wanted to make sure that I wasn't misinterpreting this.
That's correct. That is the intention, and we can certainly clarify that language. Yes, we do internal work. We do it transparently in the view of the public, of course, which is important and one of our values. So we'll make it clear that we're not referring to committee materials, and board materials for board meetings.
Thanks.
Dr. Chi, did you also, I see your hand.
Yes, thank you very much for very informative information about the communication strategy and guidelines. They're very helpful. I have a question that the communication and engagement committee might already thought through that, but just in case you haven't, in the coming year, we need to prepare how we address disinformation and misinformation, particularly when the public hear more. Those who oppose to universal health care will spread disinformation and misinformation. And to address those issues, we need both quick and wide response, because unclarified, unrefuted disinformation, misinformation become facts. And we experienced that during the pandemic. And so I think this will be an important strategy. And probably the spokesperson, Mimi, will be the point person to refute that. But we probably need to have a strategy how we quick and widely respond to disinformation and misinformation.
Thank you so much, Dr. Chi. Yes, that is something we've discussed with our communications consultant. We are developing initially, as you all are so familiar with, when we started this work, there was an idea for how it would roll out and what the timeline would look like, and that has not turned out to be the timeline that we needed. And so our current communications consultant contract ends in December. So what we are doing is developing a scope of work for a communications consultant for 2026, and that is certainly part of it. So something we're already doing is monitoring all media coverage of the work of the board so that we can identify anything that is intentionally or unintentionally misinformation or disinformation about what the board is doing. And if we identify something that is being shared widely, then we do have the capacity currently to respond, with a press release or a phone call or, those types of things. So that is something that currently we're discussing with our communications consultant, and we could certainly support you, Mimi, in conveying that message in a timely manner. And it is part of our planning for 2026. So thank you for raising that. I really appreciate that.
Are there other questions, comments? Mike?
Well, as the both old man and newbie here to this group, first of all, I totally get and understand what you're all saying, and I'm in fundamental agreement with that. But here's an issue. I have been spending this month getting oriented, and there's a couple of big observations. I mean, one is, while I think the board in general has a pretty good fix of things, I'm not sure that, and remember, I'm entering in, so I could be totally out to lunch on this, but I'm not sure you all are getting that, at least from people that I talk to, how broken the current system is, how ideas that we're exploring may go in the right direction, but don't appear, I'll be blunt, bold enough yet. And I just hope that the chassis of these 4 committee things are going to move further. And I totally get the fact that many of you are already very busy and, if anything, overextended. But my own sense is, if we do that stuff, I think we unfortunately may have to meet more regularly, or there needs to be something else, or I'm not sure that, I mean, most of the people I'm talking to, the public, have no idea what this board is or what's going on, and yet so many people think that some very basic change needs to occur. So I definitely support this policy, but I think at some point this board's got to get into a higher gear.
Thanks so much, Mike. I appreciate those comments. I hear the concern, and certainly the board, as far as the board members have all been engaged in doing these community presentations since we formed, and I think we are definitely all too aware of the brokenness of the current system in our own lives and communities, as well as the community engagement that we've all been doing prior to the board's formation and since the board has formed. I'll also just share with you that I would say the first 9 months of the Community Engagement and Communications Committee, we spent reviewing feedback that's already been given. So really reviewing what people have already shared so that we could honor that feedback. And again, also, because we have limited resources in this phase of the work as a board to do broad public engagement, we wanted to make sure that we were bringing back all of the feedback that people had already shared with the task force and in other places as well. So we did a scan for community feedback, and that was really the grounding of the Community Engagement and Communications Committee, was grounding ourselves in And as you would imagine, most community feedback that is being shared currently about people's experience with health and healthcare is pointing to a lot of the things that is not working. So I want to assure you that that is, has been, is, and will continue to be a big part of the board's work and what the board's work is grounded in. And also that the work of the board right now, in kind of to that bullet point that we said earlier, where we don't want to just focus on the brokenness of the system. We want to offer hope. And I don't think we can offer hope unless we are doing this phase of the work, which is developing a plan. The concept has been out there for a long time. Many people across Oregon, and probably all of us here, have been engaged in working towards that better system for many years. This is, I think, our best opportunity to make that real, to make that hope real. And once we have a proposal, then I think that's one of our recommendations to the legislature is, now that there's the thoughtful work, the solid analysis, the consultants, all of the things that need to go into a serious plan proposal that could be put into implementation to make people's lives better. Now that that's been completed, the legislature is going to need, in the next phase of this work, to invest in a very broad public engagement process that would have to be specifically funded for that purpose. And so that's a little bit of, I hope that's helpful. That's a little bit of
Yes,
where we
that's
see our
helpful.
work. Yeah.
Yes, that is very helpful. Thank you.
Yeah, and just this slide, basically our mandate is these are the groups that we are to reach out to for input and feedback, and we were not budgeted or directed to do a very large public engagement campaign at this phase of the work. This phase meaning the plan development and what this board has been tasked with in terms of getting a report to the legislature in 2026. Yes, Helen.
Thank you so much, both of you, for this presentation. It was really fantastic. And yeah, I just want to acknowledge, sort of in lieu of Mike's comments there, that right now, I think we're all feeling it. There is so much anxiety about healthcare right now, and rightfully so. I think people are really worried and really struggling, and that's everybody from everyday people in our communities to people in healthcare to politicians. Like, there's just anxiety across the board. And so I think just remembering that we're in a state of high anxiety, and so it's easy for things to go in directions that we didn't mean them to go. So I really appreciate this grounding in, look, it's a confusing time. There's a lot of momentum on the board. And what we need is to really focus on building a solid plan. And then the interest groups that CECC will be reaching out to are going to be our key allies. The goal is to put something so solid in front of these groups that we gain them as allies, so that when we do talk to our communities, they're all on board with us. The business community is on board with us, the healthcare community is on board with us, the disability community is on board with us. Like, we need allies. It's not, this board itself doesn't have the capacity to do the kind of broad engagement it would take to get the whole state to buy into this. But we need to focus on a couple of interested groups first. And so I think if we stay laser focused on building the best plan that we possibly can, and then getting allies from these interest groups, then that broader engagement will happen at a later time. But I'm hearing it. I'm sure all of you are hearing it. People are super anxious about their healthcare. I think, as Michelle said in the beginning, like, letting people know the board exists, we're working on it. We don't have anything, in terms of, well, not that we don't have anything, but we're not at a point to share, a detailed plan at this point. But come to our meetings, listen in, provide public comment. We love hearing from people. I read every single piece of public comment that we get, like, just encouraging people to participate in ways that they can. But it's hard to be patient, but we've got to be patient and let this process happen. We got to get to next year, September, get a detailed report together. And then at that point, the board will launch into a different phase of work, which will most likely be way more about engagement.
Thank you. Mary Lou?
Can you hear me? Am I? Okay.
Yes.
As I look at the list here, you've heard me before and heard other people giving input, and I've got people that are, calling and yammering at me about the hearing input from union members. And what I'm looking at is this dot point here on healthcare consumers, which seems pretty broad to me. And what have you got in mind for that particular group? The others are fairly clear to me, but it's what are you thinking about? And could union people be considered they are healthcare consumers?
Thanks, Mary Lou. And I will just be really honest that, Diana came back on board yesterday. That was our first meeting with Diana and Patty. And so part of this process is going to be looking at the plan proposal details as they become more clear and solid from each of the committees. And then also consulting with committees and committee chairs to see, based on what you're proposing, who do you need to hear from? Who is going to be most impacted? Who is going to, be needed for implementation? Like all of that's going to direct to a certain extent. And then beyond that, two things. One, as I think we're all aware, unions were a specific prioritized focus in phase 1 of the public engagement in 2022 by the task force. And so as this project has moved forward, one of the very first groups that people involved in developing, working towards the work we're doing today said we have to hear from labor. And so that was one of the first priorities. We don't have the capacity to revisit all the groups we prioritized in the last phase of engagement in this engagement in a specific focused way. This list is basically legislators said, this is the list of folks that you didn't successfully engage with in 2022. So we want to make sure you hear from them before, the next phase. That being said, labor is could be represented in all of these lists, right? Like that is, of course, there are going to be union members in many of these engagement groups. So I just want to make it clear that labor was prioritized first and foremost, along with BIPOC individuals and, insurers and lots of other, groups. They were the first priority. In this phase, we have to fill in some gaps. And I'm sure that we will be talking to some labor folks. And that is great. And that is by design. And the specific groups have not all been determined yet because, as I said, Diana just came back on board yesterday. So sorry that's not.
No, I hear you, but I guess I'm asking really specifically the one that seems really broad to me, and that maybe you all have an ability with Diana or whoever to decide, who are you considering healthcare consumers?
It is a place where we have a little bit of discretion. And again, that discretion will be determined by criteria, like based on the plan details, what voices have we not heard from that we really, really critically need their feedback before this moves forward? And I don't know the answer to that at this point.
Okay.
Yeah.
Just
But
registering my concern. Okay.
Yes, I hear your concern. And
Thank you.
also appreciate you bringing it forward because I think it's aligned with a lot of important public comment that we've received that we're, of course, taking into consideration as well.
Thank
Go
you.
ahead, Helen.
Yeah.
I just want to add to that I don't want anybody to look at this list and see exclusions. Like we're only talking to these people and we're excluding everyone else. That is not the case at all. We absolutely want to hear from unions. We want to hear from anybody who has an interest in our work. And if you are getting approached by people who say like, we want to have input into this, encourage them to, depending on what part they want to have interest in, they can provide public testimony, they can provide oral testimony, they can provide written testimony to any of our committee meetings, any of our board meetings. If they feel like they want to make their interests known, we would love to hear from them. We are not excluding anyone from this process. Like Michelle said, we're just filling in the gaps with this specific work with our consultant, but encourage them to come to the meeting, submit testimony, tell us what matters to them. We want to hear from everyone who's engaged and invested in this work.
Yeah, thanks, Helen, for reiterating that. And I absolutely agree. And to reiterate a point made earlier, I think we are all really committed to reading every piece of public testimony that comes before us. And there are multiple examples where public testimony has changed the decisions of the board starting with one of our early meetings when we were working on our principles and values. So, that is a really important way to give direct feedback to the board at any time. Hi, Mike. I see your hand. Go ahead.
Yep. Well, first, I just wanted to support and build on Helen's comment. I think you guys know that part of my experience is I spent 5 years as a health plan manager, and I think I'm assuming you all know that unions aren't just unions. That when I was Kaiser's health plan manager, I mean, it was very important to be meeting with trusts, and trusts are basically sometimes they're unions, but sometimes they're basically a relationship between the employer and the union. So I think there may be a way of getting at Mary Lou's sense here. And I think candidly, if I like the way Helen put it, that if there are obvious uh, folks that where if we looked at this a few years from now, saying it was really wise we spoke to such and such, I certainly think that other than the public sector stuff which we seem to be focusing on, the Medicaid and the PERS and BUB stuff, that the employer trusts are absolutely critical long term in terms of whether or not this will ever get to be truly universal. So I would just I just think it's important to get a perspective of if this is going to go from 100 different insurance companies to ultimately long-term universal health. Um, yeah, you have to have not just these committees, but you need to have a transition plan and a roadmap to get you there. And I think that's going to be an inevitable piece of the roadmap next year.
Thank you, Mike. Yes, I am looking forward to the transition committee coming up and starting that conversation. Thanks for pointing us to some of our next steps. Are there any remaining questions or comments before we close out today? Really appreciate everyone's time and thoughtful dialogue. All right. Well, if you think of something later, you know how to get in touch with us, and you will again see this proposal for an actual board vote at our next meeting. Again, the intention of this meeting was just to be able to have space for this conversation since our board meetings are so packed. I really appreciate you all making time on a Friday morning. No decisions, of course, are made today, and all the materials covered are publicly posted with our other meetings. But thanks for making time, and have a great weekend.
Thank you so
Thanks,
much.
everyone. Happy
Thank you.
Halloween.
Thanks,
Thanks, Helen.
Michelle. I really appreciate it. And everyone,
Thank
watch
you
your
very
email.
much.
Watch your email, everyone. You're going to get some homework before the next meeting to review these. So keep an eye on your email. Thank you so much,
All right.
Michelle and Amy.
Yeah, thank you. Bye.
Bye, y'all.
Bye.